A group, Slum and Rural Health Initiative in collaboration with Okapi Children Cancer Foundation, has held a sensitization campaign to educate children in internally displaced persons camp on cancer in kits and where to seek help. The group made this known while addressing Newsmen at New Kuchingoro IDP camp in Abuja. They say more funding and donations to the cause of cancer kits will go a long way in alleviating the suffering and providing better treatment for the patients.
Childhood cancer is something that hasn't received a lot of attention in Nigeria as a whole, and we decided to bring it down to the grassroots level to let them know that childhood cancer is treatable, it is not contagious, and they can get help if a child has cancer. We're also here with other NGOs and Silver Cross Group, and we're conducting free healthcare for over 100 indigent people at the IDP camp here at Kuchingoro. We've been able to support over 200 children with childhood cancer at National Hospital, Federal Medical Center and University of Abuja Teaching Hospital, Gwagwalada. Apart from the funding childhood cancer treatments, we also do psychological support, emotional support for parents of children with cancer, economic empowerment as well. And I mentioned earlier this sensitization and awareness in secondary schools. And for the first time, this is our community outreach program. Childhood cancer cannot actually be prevented, but what we advocate for is for early detection and early treatment. If a cancer is caught in very early stages, it is easier to manage. The prognosis and survival chances are far better than when left till the disease has progressed. We have not received any government funding as at today, so all of our donations and funding we get is through friends and family. As you can see, lots of volunteers here today. Everybody is on a free will basis. We receive no form of government funding.
Actually, you can really see on their faces from their testimonies that are really glad receiving medical services free of charge, free consultation, free drugs, and also the sensitization from the Okapi Children Cancer Foundation. They are really happy about the program. Slum and Rural Health Initiative mission is to bring to the slum and rural areas or underdeserved people, to bring healthcare services and information to them, and that was what inspired us to be here. We look at the IDP is one of the underserved part of people in the country, and we thought of it coming to give them information about their health and also to assist them medically. Those in the rural community should be adequately taken care of. You see that most of the times you see that the healthcare services in the rural area are very poor. Especially here, you see we just have a small clinic here which do not have required medications for the community. We request from the government to look inwardly the IDP persons, to look at their health issues and also to look at ways to bring medical services down to them. They should always seek for medical advice anytime they have any health challenge, other than taking medications on their hands.
There's a lot that can be achieved if a lot of people come together. We on our own, we can do only so much more. But with the government, if they can make policies that, or a budget, if we were included in the budget, childhood cancer especially, if there is a focus on it and there is a set of money aside for it, it can go a long way. Because on our own, yearly we get between 10 to 15 million just within groups, family, loved ones and friends, and donate it to these 3 hospitals. So imagine the government is with us on this. We would be able to reach out to so much more, because sometimes we have like maybe 10 million and then the money that is probably needed is like 50. So it can only be enough for just some of them, not all. But with the help of the government and with help of other well-wishers, and we are calling out to anybody who can see me and who is hearing this, you can be a part of this. You can save lives, you can impact the children, you can do so much. Even your voice is enough. If you can tell people that childhood cancer exists and that there is no cure for it, there's no non-cure, no non-cause, but early detection is key. And that your little 1 naira, little 500, that is how we've done it. In the past, when our president, how the whole entire thing came about in 2017, when Okapi was established, she had her brother who was ill, and on his passing on, he told her to carry on his legacy of helping the children. And that's what she has been doing since then, just with a few friends. Today, we have a lot of volunteers and we have a lot of people supporting and channeling their efforts as volunteers to help fight cancer, childhood cancer. So if the government can step in, we can achieve a lot much more. We are in Abuja, we can do Lagos, we can do other states, we can even go worldwide if we have the support. So we are calling out on everyone. All it takes is a love in your heart and a passion to assist. Not many of them know about cancer of any sort. While some know that there is cancer, they don't know there is childhood cancer. So I talked to them about childhood cancer in their local dialect, which was Hausa. I gave them sensitization on the word cancer, on childhood cancer, symptoms of cancer, and how they can get help should they find out from the hospital that they have cancer, their children have cancer. And then I told them about the 3 hospitals that were presently giving assistance to the children there. And I also told them that we have a cancer survivor. His name is Shitu, and he had cancer when leukemia. And today he's free from cancer. He's a survivor. Why? Because early detection saves life. And I also told them that childhood cancer or cancer of any form is not a death sentence, that it can actually be cured if they detect it on time.